entrepreneurs. Sharing knowledge and stories is why I started telling it like it is. It is live. If you have any questions, plop it in the comments. If you're watching this after the fact, we welcome questions and they will get answers. I would like to thank Bitvo for their sponsorship. They are Canada's premier cryptocurrency exchange. They have just released 4 new coins. They are digital currencies, real people. Their website will be in the comment sections right away. It's scrolling across the bottom of the screen, and it's bitvo.com. And today, as usual, I am pumped about my guest, and we'll be getting after it right away. But Dr. Jordan Vollrath, one of the founders of Cherry Health, how are you today?
Good morning. Doing well, thanks. Thanks for having me.
I always, I always laugh about our conversations beforehand, and people come on, we chat, make sure things go well, and in yours and my conversations was about marketing, Trailer Park Boys, and Kenny versus Spenny.
Great shows.
Great shows, but that kind of ties into really the importance of networking and how we met. And I love talking about those things because it's so important, and we'll dive into that in a little bit. But we met through Startup TNT when you guys did your first pitch night.
Yeah, that was kind of a whirlwind. Like, we wound up getting linked into that through one of our mentors, Tim Lynn. And he told us about the whole startup pitch contest they were doing. And then we wound up just like at the 11th hour sending in an application, got accepted there. And then that was actually like the first time we'd ever publicly pitched Cherry Health.
Well, and I, which is also amazing. And we'll talk about the importance of, putting it out there, getting into the pitch competition, how it benefited you. But that, why in the last minute did you decide, like, wow, what the hell? Was it just one of those things? You never know. Or was there any strategy behind it?
We were just like scrambling. Like, we were just getting so many things done at once. Like, we honestly felt like chickens with no heads for a good 8-month period there. And so we were starting to get into fundraising. Like, we were putting together a pitch deck. Like, we were kind of doing this preparatory work. And then he was like, yeah, there's this pitch contest coming up. You guys should enter. By the way, the deadline is tomorrow. And I hadn't checked my email in 2 days. So the deadline was actually yesterday by the time I saw it. And then we're like, okay, I guess this is it. Yeah, let's throw our hat in the ring.
Well, so let's talk a little bit about how Cherry Health got started. How did you come up with this idea? I mean, obviously you're a doctor. I'm guessing that had something to do with it, but was it just you sitting around having beers with a few friends, or did you actually see a serious problem?
Well, so I'm a family physician. That's my background. And so one of the things we do is temporary coverage called locuming. And so think about substitute teachers, right? Like, you need one-to-one coverage, otherwise the whole thing falls apart. So if anybody's sick, if anyone goes on vacation, or they just need to be gone for whatever, you need another teacher in there to actually cover for you. Otherwise, you've got a whole bunch of people out and there's nothing happening for the day. So the teachers have this central call room, right? You need a substitute, you need a replacement. So the regional school board coordinates that. Now, you'd think that healthcare and doctors would have something similar, but they do not. It's just kind of chaos. It's a huge mess. So all these physicians everywhere practice independently, and there isn't any central authority actually handling or doing the oversight for this locum coverage or this substitute doctoring. And so I myself, as my first year or so in practice, I was doing the substitute doctoring, and it was awesome. It was just a huge pain to actually arrange all these different jobs. So that's how we came up with the idea for Cherry Health.
So is that just more in the family practice? So if I'm, Dr. Nadeau at the Silver Springs is our doctor and she's sick or a handful of sick, they would just have a list and just start, the receptionist or whoever would just start making phone calls to find somebody to step in that day?
Exactly. So you try and reach out to every single doctor to see if somebody's available to cover for you. And very rarely is that actually the case. Like, what are the chances that, the handful of people just happen to have a free slot in their schedule when you're getting sick, or, if you're trying to have a long weekend or go on vacation. And then so at that point, depending on how desperate you are, you can try and get everybody to reach out on your behalf to everybody they know to see if they can find somebody to cover for you. It just doesn't work very good.
Does the same happen for like ER and those types of, or is there a different setup in the actual hospital?
Yeah, in the hospitals, it's a little more under control. They have some administrative people doing the oversight. So for specialist physicians in general, they just don't locum as much as family doctors do. They certainly do, and certainly specialists out in the rural settings as well. But for the most part, like locuming is far more common amongst the family medicine population, which is the bulk of physicians.
So how many? So did you just find when you were done, obviously medical school, you were ready to go, you slide into wherever you want, you just figured, you know what, I just want to be a substitute doctor and see how that goes? Is it something that a lot of people do, or is it not that common of a practice?
No, no, it's really common. So
Huh.
you pop out of your training, you've done a whole bunch of rotations, you've been all over the place, but you still there's a lot you haven't actually experienced yet. So people will do this locuming, pretty commonly after graduating, just to get a sense of where they want to work and what kind of clinic they like, what type of patients. There's a whole bunch of subspecialties you can do within family medicine. So people wind up playing the field all over the place.
I guess that's kind of try it before you buy it mentality. If you want to find out if you can actually work with fellow doctors, is it a good culture, those types of things.
Yeah, exactly. So you honestly you surprise yourself too. Like I did a whole bunch of different things, out in rural areas, in the city, walk-in clinics, regular clinics. And so sometimes you go into it and you're like, oh, I'm actually like kind of surprised. This was a lot cooler than I initially thought.
I'm sure, and I'm sure it's probably a bigger problem in rural, as you said. Like, if a doctor has a clinic, how the heck is he going to find someone locally? Do you find a lot of like, how far would somebody like a doctor like yourself go out of Calgary to do a locum?
It depends. There's doctors like there's people that just literally live in a van and they'll drive all around the country doing these locums. More commonly you see people moving around within a province, but there's definitely like the rural locums who pretty much specifically just go all around to small towns. You get to do a little more. It's more interesting as a family doctor because then you're working in the hospital, seeing patients, doing rounds in the morning, doing 24 hours in the ER, delivering babies, like the full scope of practice versus more in the city. You wind up typically just doing more like bread and butter family clinic.
Well, I guess that kind of leads me into how the app works. So, obviously, you being out there, you running through it, probably getting just regular phone calls, email, text messages from family doctors' offices. How easy was it to say, "Hey, I can just put this together"? Was that how it popped into your head?
Yeah, well, that was part of it. Was I just had so much experience doing these substitute doctor jobs, and I really like doing short notice and shorter duration ones just to get more variety. So after having seen, a whole bunch of different ways of how people practice and how they actually arrange and manage these locums, it made it quite a bit easier to come up with a design for a network that would actually facilitate that.
And then it was just, okay, I need to come up with a name. I need to come up with a tech to do this. Did you figure it should be a website? Why did you figure it should be an app?
There was websites out there already for it. None of them really worked, but there's no apps. So we figured maybe that would be a good starting point. So part of the problem is that it's been a problem for such a long time. So every once in a while, somebody comes along, acknowledges that finding locums is a huge problem, and then all well intending, they'll try and fix it. So they'll come up with another Facebook group or another website to post your locum jobs or something like that, and it winds up not distinguishing itself from the 1,000 other point solutions out there. So it becomes number 1,001, and it just winds up further fragmenting this really, really scattered population. And it just becomes really hard to actually do because there's so many different little point solutions for trying to find the substitute doctor coverage. And so we really wanted to do something that would actually stand out from the crowd, aggregate everybody into one system. And essentially the goal was to centralize it, because the biggest problem of all was just how fragmented it was. So that's kind of how the app played into things. It was really flexible. It let us do a lot of things that if you're limited by your web browser, you can't. And then it was novel as well. No one had tried it yet.
No, I think obviously if you do the same thing over and over again, you're going to get the same results, right? So it makes sense to move it into an app. So Please explain how the app works from the doctor side who wants to sign up, and then the clinic side who are looking.
Yeah, so it's honestly it's kind of the Uberization of medical jobs. So the the doctors, everyone has their own personal profile, and then the clinics all have their own facility profile. So kind of like Airbnb, actually.
Okay.
So you go, you search through, you can see the clinic, you can see their jobs, their dates, and everything. And then you book in, they'll get notice of your application, they review your profile, and then it's kind of like your digital resume with your work history, your experience, your credentials. And then something new that we wanted to throw in there was the ratings and reviews. So again, back to the Uberization. So part of the trouble with locuming is that there'd be bad experiences across the board. So I, as a locum, like one clinic took more than a year to actually pay me. Some clinics are just suboptimally managed or organized. Some you show up and it's not very busy and it's kind of a waste of your time. And so there's things that make people uncomfortable with going to do it. Just how the same way you'd be, more comfortable going to a new restaurant after seeing the reviews, or hopping in somebody's Uber after seeing their driver rating. And so that's something we wanted to put on there. And that's a two-way street as well. So sometimes clinics will say, the last locum they had come in was late I'm bad at being late, so that's a bad example, but the locum was late all the time, or they just were a bad fit for the clinic in terms of the patient population they have versus what the locum was trained in. So we wanted to kind of just facilitate better matching.
So I guess on that, I mean, if I take my Uber, I give a 5-star, get a 5-star, or 2-star, whatever it is, right? There's kind of no vetting system for that. So is there any way that if a doctor just didn't like someone there, just gives them a crappy rating, or do you have a way to make sure that the clinics don't properly, or get the rating they need?
So it's an interesting subject, and it comes with mixed reviews for sure. We haven't started policing anything yet, but this is definitely going to become more of a prominent thing over time. But I don't know, at some point, like, you're dealing with a lot of professionals for the most part, and so we're optimistic that it won't be that big of a problem, but stay tuned.
Yeah, I guess you just never know, right? Someone has a bad day and gives them a 1-star, and away you go, right? It's not
well,
fair.
It's like, what do you do with that, right? Because they probably genuinely had a 1-star time. Maybe it was an off week for the clinic or the doctor, but like, what's I mean, that's kind of the whole point of having ratings on there, right? Is so you could start getting a better picture of what's going on.
No, I agree, right? I mean, and as you said, right, you want to make sure that, especially on that paying example, I mean, that's awful. Like, there's no way that somebody should take a year to give you, if you worked one day or 1 month there.
Exactly. And so a lot of people wind up not locuming very much because there's just, all this uncertainty associated with it. And so there's this chronic shortage of just locums out there. Like, clinics are pretty much fully desperate for locums because everybody's overworked. Everyone hasn't taken a vacation and who knows how long. So by actually like making the whole system easier and more attractive for physicians to do this, we can start actually closing that gap.
No, I think that's a good thing, because one thing we do need is doctors. Make sure that you never know when you need them. When you need them now. You don't need them, in 2 days. So obviously, and I imagine that they need holidays just as much as we do. So if not more.
It's crazy. You should see some of the horror stories we hear about. That people haven't taken a vacation in years because they just can't find somebody to cover for them, or it's tough.
Yeah, that's got to be. I mean, that's just not good for their personal health.
Oh, yeah, the burnout rates. So physicians have the highest rates of burnout of any profession. And I think a lot of it is in part due to that poor work-life balance.
Oh, I would 100% agree with that statement. Like, it's shocking to me. Again, I'm talking to Dr. Jordan Vollrath, the co-founder of Cherry.health. You can click on their website in the comment section, or plop any questions that you have in there, and we will answer them. So you mentioned earlier on that the last minute entry into Startup TNT, and it was your pitch. And obviously, we're going through our investment summit right now. Tomorrow, we're going to be narrowing it down to the top 10. So why don't you explain your startup TNT experience and how it benefited you, or maybe it didn't?
No, startup TNT was an awesome experience. Yeah. So we really enjoyed it. That was like the first domino to really start to fall when we started our fundraising. So it actually really started building up quite a bit of momentum with us. And if any other, budding entrepreneurs or startups are out there, I'd highly recommend getting involved with them. So not only was there the money from the startup TNT community, but also the exposure that came along with it, which is being in a pitch competition. So we started hearing from other investors locally, and then that started building up more and more momentum. It was really fun too, actually, just being a part of it. And everything was digital. It was all through Zoom anyway, so it was very like non-threatening. As somebody who had never pitched a business before, it actually went like quite well. They guide you along. They talk about how to actually like populate your data room with everything investors are going to want to be looking at when they want to look under the hood and see how things are going. So it was kind of an educational experience as well at the same time.
So, I mean, your first pitch, you obviously did extremely well. You got funding out of there. Is there, I mean, other than the money, you kind of touched on it, was the connections, the people, advice, what else did you find beneficial from TNT?
Yeah, the networking for sure. So unlike in healthcare, where it really is what you know that matters, in business, it's who you know. And so just the actual connections we've made through there, tons of meetings in terms of like hiring and staffing and just like advice and mentorship kind of across the board. Like that's how me and you linked up, was through that. So you never know where the next connection that's really going to pay off is going to come from. And so these networking events really can be high yield.
Oh, totally agree. I mean, networking, and it's one of the reasons why I start off where we met, how we met, those types of things, and because it's the number one thing in in business. It's getting yourself out there, putting yourself out and out there to make sure that you're talking to anybody and everybody, because you never know who's going to be able to help you.
Yeah, and then you wind up getting legs up from the most random of places. So definitely that's one big learning point I found out when making the transition from healthcare to business.
Well, I mean, it wasn't a simple transition.
It's its own ongoing process.
Well, the only story I like sharing is when I saw you post your marketing thing on LinkedIn.
Which one was that?
The one where he's like, we want to hire somebody to do all our marketing.
Oh yeah, that was a lesson well learned. Yeah, I was getting messages and yeah. So just to fill anyone in, we were looking, I think it was a website we were looking to get redone. So I just naively posted on LinkedIn like, hey, does anybody know how to make a website or recommend anyone good? And for the next like 6 weeks, my email inbox was just swamped with people from like literally across the globe who had somehow seen this post.
Yeah, well, I mean, and don't get me wrong, LinkedIn's a very powerful tool, and that goes to
Clearly.
show you. I mean, but there's certain things that you're going to get a lot of emails on if you post. That's for
sure. It was like 8 hours into this post being up, and Jade saw it. He sent me a message to warn me to take that down, and I was like, "What do you mean?" That's what I wanted people to message me, but little did I know how overwhelming it would quickly become.
It'd be nice if you got, a handful of them. Oh yeah, these are all good. So, I mean, now you've kind of run this little, your gauntlet, and I'm sure it's been a little bit overwhelming, from pitching to funding, to now, getting out there, to selling, to trying to make it a business. So what's next for Cherry Health?
So at this point, growth, expansion. So now we've got slated Ontario coming up next month. So second week of November, we'll be opening up the physician locum network out east there. Following that, then we're just going to be working our way across the rest of Canada, province by province. And the whole goal is just to hit this critical mass in each region. So having a few locums and a few clinics over there and some over there and some down there, it's not particularly useful. The whole system really is dependent on density. So we're just putting all our efforts and our marketing and our growth energy into one region at a time, just to get the whole thing off the ground. So now that we've actually seen this momentum and this critical mass start moving around in Western Canada, we figured it was time to go out east.
So, well, Do provinces have different rules for locums, or is it pretty much a universal?
There's nuances to it, like how the doctor gets paid or different types of fee structures. But across the board, I mean, you find locums pretty much everywhere in Canada.
So what about post Canada? Is locum something that's I always hear that kind of UK is more similar to Canada when it comes to healthcare, whereas the US is the US. So do they have to expand? Let's take talk about world domination. Is that something that you have? Who's next after Canada?
Yeah, 100%. So international expansion is really, really appealing. Just bigger market sizes, right? So each system has its own nuance. Like ours is designed to run off of a public payer healthcare system. So, like you mentioned, somewhere in the UK, potentially Australia. But yeah, the US definitely is an attractive market. So down there, it's a bit different because they've had privatized healthcare so long. There definitely are solutions in place for the locums. So how it works down there, as opposed to up here, where it's kind of just this free for all disaster with no organization, down there they have these big like staffing, recruiting giant agencies. And so you pop out of your training, you sign a locum contract with one of them, and then they kind of just internally assign you somewhere or sort you to different places. So the thing is, they garnish like a huge proportion of the physician wages, like as a contractor, subletting them out basically. So there's a lot of disdain from the medical community for these staffing services. So it's something like the Cherry Health, where it's this self-serve, there is no middleman, kind of the budget do-it-yourself solution, would be highly disruptive to what they've got going on down there.
Oh, that sounds like it's a win-win for both the clinic and the doctor, right? If it's
Yeah, exactly. Well, I don't know. The U.S. healthcare system is pretty bloated with administrative overhead just across the board, and so definitely like the staffing and recruiting space is no exception.
Yeah, and then that's not shocking to hear either.
No, yeah, they spend like 18% of their GDP on healthcare versus Canada spends, I think, 11.5. But we live longer and have better healthcare outcomes, so their system's got room for improvement.
I think lots of room. They just like complaining about everybody else's that doesn't work.
Yeah.
So I'm always sad when our conversations coming to an end, and you yourself and your team with Dr. Max and Adrian have done a fantastic job in such a short period of time. So this question is probably really fresh in your mind because you're kind of doing everything, in the last year or so. So if you had one piece of advice for a small business startup or entrepreneur, what would that be?
I think the number one thing owing to our success is the team, for sure. So like if I had come up with this whole idea in isolation, I don't think it would have gone anywhere. I don't think it would have gotten off the ground. So initially, when I partnered up with Max, he had already had a lot of experience in the business side of things, in the startup space, in entrepreneurship in general. And so that marriage of the problem and the healthcare with the business and the technical knowledge. And then later on, when we linked up with Adrian, and he has 20 years of experience in business and just like way more domain knowledge. And so really the team is the biggest thing. And so for anybody out there who's doing it alone, like it's definitely not easy. So at that point, like the more networking you do, the more connections you make, definitely the better, because it's a tough thing to do on your own.
Oh, so hard, so hard. I mean, and again, I talk about this a lot. Even in our ecosystem, in Alberta, it is so collaborative. There's so many people out there that will help you. Whether you're involved with Startup TNT or not, you'll be introduced to somebody here, somebody there that will, not going to sit there and go, hey, I'm going to charge you for this or this or this. But yeah, I'll give you an hour of my time. Let's go have a coffee. Let's go have a beer. And, I'll introduce you to, this person and that person that will get you to the next level. So I couldn't agree more with the networking and having a strong team, because again, doing it alone, it is so hard.
It's tough. Yeah. So like if Max was having a bad day, there's a good chance I'd be having a good day, and then you could kind of level each other out or vice versa. Now that there's, 5 of us doing it full time, everything's a lot more stable in terms of the highs and lows. But yeah, like you mentioned, like the startup ecosystem around here, it's not huge, right? So it's like a small community in its own right, and you meet people who are just genuinely interested in networking and connecting because they enjoy it just recreationally. So there's no shortage of people to meet and connections to make, and definitely just reaching out for sure.
No, absolutely. Again, I really appreciate you, coming on and sharing your story. You guys are obviously got an investment from Startup TNT, and I'm involved in that investment too. So I'm along for the ride. So I'm excited about it. I love what you guys are doing, and you guys do have a great team. You're also in the community and giving back and going to networks of events and sharing your knowledge and story with other people. So kudos to you on already giving back as you're still trying to grow your business.
Yeah, no, it's a fun process. It's been an enjoyable ride.
Oh, and it's only going to get more fun the ride, that's for sure. But again, thank you again. Thank you to Bitvo for sponsoring this show. Again, check out everybody's website in the comments section, cherry.health, bitvo.com. And again, thank you for joining us. And I hope everybody enjoyed this show, and we will see you next week.